Hi, everyone. Thank you for joining us for this very special recording. We are here today with some guests that maybe some of you know, maybe some of you don't, but on a very important topic. And that topic is med services and med clearances. And so my name is Susie Church Brown. I am a parent and wellness coach here with the Big Purple Blob. And I am here today with some folks from Med back in the mothership in Washington, D.C. So first of all, I have Director Jennifer Mona.
Hi, Susie.
If you would go ahead and introduce yourself.
Hi, Susie. My name is Jen Mona. I'm a Foreign Service medical specialist, a physician assistant by training. And typically you would find me at a health unit overseas, looking after families and employees. And so far I've served in Abuja, Nigeria, Brasilia, Brazil, and a little bit in Beirut, Lebanon, as well as some other posts temporarily. And now I happen to be back here in DC as the Director of Medical Clearances, helping to shepherd in some really important changes in clearances, specifically clearances modernization. So thanks for having me on today. Happy to talk about it.
Thanks for joining. We also have Dr. Kip Keenan. Would you like to say a little bit about yourself?
Good morning, Susie. Thanks for having me. Sure, I'm Kip Queenan. I'm a psychiatrist. I'm an RMOP, Regional Medical Officer Psychiatrist. And I'm currently working in DC. I'm the Deputy Director for Mental Health Services overseas. But I've also served overseas in Beijing, China, and Sao Paulo, Brazil. And I do have a role in the mental health part of clearances. So that's kind of what I'm bringing to the discussion today. Thanks.
Excellent. And we do have some really important mental health related questions. So a little bit of background. We had our first call with Med back in April or March, right before the new clearance process was rolled out. And now we are fortunate enough to have gone through that rollout. And I'm sure that you've had a lot of feedback on your end in Med, but I think that there's still a lot of questions out there. And so I have some questions right in front of me. Maybe we can just go through them, but feel free to pitch in anything that maybe we're missing or any additional information that we'd like to add. First, let's talk about clearances. And that is a big concern for any family or direct hire employee, EFM, as they're facing going overseas. What type of scenarios might not give a clearance? Is that even a consideration?
I'm so glad you asked that question, Susie. And I absolutely agree. Like, this is a really important piece of the administrative pie for everyone trying to go overseas. And, you know, these changes that we're implementing are designed so that we're making this process feel less punitive, less gatekeeping, and more collaborative, more supportive, more personalized, less of sort of this faceless bureaucratic step that you have to get through that kind of holds up everything else in the chain. We understand exactly what that's like. Most of my staff here, there's about 50 people here, have experience overseas, and myself included. So one of the things we're striving to change is making that feel like a supportive encounter as opposed to a bureaucratic step that you need to sort of get through. And to your question here, now, what types of scenarios might not give a clearance? I get this question a lot. I really like getting this question because it gives me an opportunity to clear up a misconception. There is no specific condition that will bar you from overseas assignment. Every single person is looked at differently as an individual. And so one person who has a particular condition, how that disease manifests for them, how well controlled it is, those are the types of things we look for. When it comes to finding people a post that can meet their needs, we're looking at what types of resources they need. So that's really the determining factor. And today, there's very, very few things like, you know, serious conditions that would actually prevent you from being able to serve. And so it's an individualized assessment that we do in each individual to figure out, okay, what does this person need? What's going to help them get to success? What are the kinds of things they need at their post of assignment? Or are they willing to maybe travel away from their post assignment to obtain that care? if it's not available at post. So that's kind of the lens we're looking at when we look at clearances.
It feels a little like, and this is a comment I got from a conversation with a friend, and they thought that it kind of feels like now the onus for getting care is more on the shoulders of the employee and or family member, vice on the shoulders of med or the health unit. And I'm not sure it's quite that clear cut one way or the other, but how do you feel about that thought?
So that would be on the shoulders of the person if they were willing to go to a place that didn't have what they need. Maybe in the past, that place wouldn't have been approved, but that place could be approved now. So just so long as that person understands that that follow-up care is their responsibility. So let me give you an example. Janice was just offered a handshake for Jakarta. Janice is a breast cancer survivor. She just 5 years out. She's had her surgery. She's had her chemotherapy. She's in remission. All she needs at this point in her care is every 6 months, she sees her oncologist. She gets a mammogram, and then every other 6 months, she has to get an MRI. This is a pretty typical thing to do with breast cancer. And so she's stable. She's healthy, right? She's in remission. And she wants this job in Jakarta, but Jakarta does not have good breast imaging services. So we would say to her, maybe back, 10, 20 years ago, she may have had Jakarta not approved. But what we're going to do differently now is we're going to sit down with her and say, look, we recognize that you want to go to this post, but just know that those breast imaging services aren't available there. Let's talk through, if you really want to go, we'll approve it. If you don't want to go, we'll deny it. So it's sort of at the patient's choice now to say, no, I don't want to go to a place that doesn't have the resources for my children, or I don't feel comfortable serving in a location that doesn't have a cardiologist. However, people now have the choice to accept that post and say, actually, yeah, Jakarta's got great schools for my kids. I really want this job, and I really want to see my oncologist at home anyways. I'm just going to travel back home and take care of that. And so what we're going to do is help Janice come up with a care plan for how she's going to do that. Okay, every 6 months, you're going to go back home. Or, hey, did you know Singapore is really close and has really good breast imaging? That's an option too. Let's explore that a little bit. And so that's sort of the change in someone being able to take on more responsibility. It's really only if they decide they want to, or if they decide they want to go to a place that doesn't have everything they need. The responsibility is on the patient now to say, okay, I'm going to fly back home. I'm going to take care of this on my own time. Any kind of routine care isn't eligible for medevac. That rule hasn't changed. So we just want people to know, okay, absolutely, you can take on this additional responsibility. Let's explore what that looks like.
And
does that help clarify it?
It totally does. But on that, does that mean that one would be less likely to qualify for a medevac, or just not for the routine care?
Second part, exactly. So the rules of medevac are not changing. And this is an important point I'd like to clarify too, because I see a lot of people getting nervous and saying, well, if I decide to go to this place that doesn't have what I need, what if my cancer comes back? Like, am I not eligible for medevac anymore? What if my condition worsens? Do I not get a medevac for that whole condition? And that's not true. Just as always, any urgent need that pops up that can't be managed at post can be eligible for medevac, whether that's the condition for which you took the additional responsibility or not, or something new. You're not waiving your right to a medevac. Those rules aren't changing. But medevacs are never for routine follow-up care. So we just want people to understand that, yes, you can go home for your mammogram, but you'll have to fund the travel yourself. And there's many mechanisms for doing that, right? Like your hardship differential, there's extra money in that because of medical austerity. Your R&R tickets. I think we think that R&R means rest and relaxation. Actually, it means rest and recuperation, which I think is super interesting. I think when it was in its inception, the intention was it was for these types of things, right? To go home and take care of whatever you need to do, whether that be healthcare related or not.
Well, and anyone that's been back stateside and is living out of a suitcase for 3+ weeks knows there's no relaxation involved in that. So
exactly,
we've already debunked that one.
You know what, Susie? Like the expectation that people are going to take care of all these health needs during that small period of time is sometimes unrealistic, right? Like it's hectic. And getting in to see a provider is really difficult in the United States right now. So this is part of what that care management kind of helps people think through is like, okay, let's come up with something that's realistic and is going to work for you. And hey, make sure you're scheduling that 3 months out, or make sure that you've got enough time if you need to have something done before you go back to post, that it's kind of, you close the loop, right? Because that's another medevac rule, is if you know you had something, but you travel to post before getting it completely taken care of. Let's say you had a mole removed, but then you traveled to post before you got the result and found out that it was, cancerous or something, you wouldn't be eligible for medevac back to the US. And that's something our foreign programs team can help you with as well. That's the medevac department. It's a really poorly titled department in med. We don't know why it's called foreign programs. They get very strange emails from all over. So foreign programs is the medevac department. But yeah, they can help you through, if you're home and you need some testing done. We also have a resource that's really great called MedConnect. MedConnect helps you get, you're familiar with it, Susie? I see you shaking your head. Yeah.
Yep.
Okay, so MedConnect will help get you in for that mammogram or get you in for things that you need to do. They're not going to replace your primary care provider, but if there's a specific test that you need help expediting while you're home on that short R&R or home leave, they can help you do it. So care management, this program that's happening in Med Clearances, the idea is we're helping people just think these things through ahead of time and be really pragmatic so that they're getting the care they need.
And a plug for that service to make those medical appointments. Like if you don't have a general practitioner stateside and you need to see a specialist, it is almost impossible to get that appointment in time unless you're planning for next September and it's November right now. But
Exactly.
it is so helpful. And you should do those appointments, just like, this is not necessarily related, but do those appointments at the beginning of your trip so you have the results before you try and go back to post. Yes, definitely. So we've had, and this is from Family Brown and from all of the folks I know that have had to make the decision to do, for example, a birth or some sort of care. If you have kids, it's a lot easier if you do that appointment overseas, even if it is a medevac, but you choose, for example, a medevac point like Singapore or what have you. But we found, and maybe it was just our medical practitioner at that time, but they were very, very, very strongly urging us to go back to the States to get those appointments. Is that still the same general thought pattern, that we should go back to the States for any kind of medical procedure?
It really depends on the procedure, it depends on the patient, it depends on the post, and it depends on what the post has. And so part of our role overseas, people like Kip and I, or Dr. Queenan and I, is we spend a lot of our time sort of trying to vet local resources. So we try to find specialists that we think practice well. I will say a US standard of care is by definition not available overseas anywhere. And so it's important that people understand that and have their expectations managed a little bit when they go overseas. What we're doing is we're trying to find the person in that place that practices as close to it as we can find. And the best way to do this is actually to follow patients through their journey and sort of see a real life patient. We go on a lot of hospital tours and they give us tea and we can kick the tires, but we don't really see, where the true rubber meets the road until we have patients that we actually have to put through those scenarios. Myself, I actually try to get all of my care overseas for that reason. I think being a patient is actually the number one way to see how good these resources are. And what I find sometimes is that a patient's subjectively positive experience does not always equal high-level evidence-based medicine. And oftentimes the patient might think like, I'm getting really good care here. I think this is really great. We might not agree. It might be adequate. And if you needed something more, such as surgery or procedure, we might encourage you to go home based on information we know about how that's done there, or the confidence we have in those providers, or maybe we are confident in that provider you're seeing, but if you had a complication, let's say, of that said surgery, for example, I'm not confident maybe in the blood products of the hospital or in the additional specialist that might be called in to treat you in those scenarios where not everything went right. So it's really based in our confidence in the local system. Or if I was brand new there and I hadn't had a chance to go around and kick the tires, I wouldn't be so confident in saying, yes, I think this is great. I think these people are, this provider is going to do what you need them to do. We do keep a big database. We do take notes on all of this. This is really important information. And I think Department of State Med is the largest keeper of medical intelligence overseas, honestly, because we really use these resources. So trust your health unit if they're encouraging you to go back. They probably know. And in some cases, there's been cases before where I've seen someone go to like a provider that wasn't known to the health unit, wasn't on our list, and not have such a great outcome. And people will ask me, hey, do you recommend this person? I heard this person said they're really good. And I'll say, no, I really recommend you to go home for that. And I can't really say much more. Privacy is of the utmost importance. We have really tight communities. And if I were to give someone any indication of why I didn't think that was a good choice for them, I might be violating you might be able to figure out, right? Like who I'm talking about. So I'm very careful. We're all very careful when it comes to privacy, and we don't want to give up anything. So if we said, oh, we saw them follow this condition or this type of situation, we wouldn't want to, right, violate someone's privacy or make it obvious who we're talking about. So we might not be able to share exactly why we wouldn't recommend that resource, but just tell you, yeah, we wouldn't recommend it. We'd recommend you go home. If that makes sense.
It does. It totally makes sense. And it helps to hear like that point of view where you're not just saying, no, we go back to the States. I mean, there's definitely reasons why the US has such high standard of care. And so it's nice to hear all that.
And so many pieces of what's, your experience overseas are going to be different, right? Like privacy is so different. The level of privacy we have for our medical care here in the US is kind of unlike anywhere else. Patient-centered communication. You might have really good specialists, but they're not going to tell you what they're doing to you, or they're not going to explain things or what's going to happen next. Nursing care. Nursing care in the United States is at a really, really high level of professionalism that doesn't exist in most countries overseas. So maybe you have a good specialist, but the nursing care is poor, or the administrative support is poor, or their aseptic technique, right? Like keeping things clean and preventing you from infection isn't really great. There's all these different things that contribute to the nuance of the experience you'll have and how adequate your care will be. Even in places where care is really good, like Germany, for example, excellent medical care. But you might find yourself in, a state of undress in a waiting room with a bunch of Germans in a similar state of undress. And that's really uncomfortable for an American, right? Like we've never had to deal with that before. So there's a lot to it.
I got to experience medical care in South Africa, and no one prepared me for the ward situation where it was not just me in that room.
Yeah.
It was a little disconcerting.
Right.
Quasi-related, but not necessarily a med purview. Getting prescriptions overseas is honestly, it kind of every prescription that Express Scripts receives, it feels like it's the first prescription they've ever had to handle before. And it is, I mean, I don't even know how many times we've put in our billing information. It's like literally we're all a family. My 13-year-old isn't going to have his own credit card. And so it blows my mind how complicated it is just to get prescriptions. I mean, is there anything we can do about this?
We in med, there's a bunch of different types of prescription mail order. So some, depending on your insurance, you might have CVS Caremark. If you have Blue Cross Blue Shield, for example, Foreign Service Benefit Plan has Express Scripts, but there's a lot of them out there to varying degrees of, performance, I guess. And unfortunately, we don't have any control over what they're doing internally, but we do have a lot of tips and tricks and best practices that we can share. And at your next clearance, you're going to be paired with a care manager, and that care manager can kind of walk you through, okay, is this a medication available at post? And is it okay there? Because maybe you could just get it at post. That might be an easy way to circumvent the mail order. They're going to give you some best practice advice for cold chain medications, especially, and how to get those overseas, because that's a really tricky pain point for patients. We don't want it to be something that gets in their way of their tour. There's clever things like you can ask your provider to write for what's called a vacation override, so that you can get a large quantity at one time, so you don't have to do this very often, this painful experience with the mail order. We recommend that everyone travel to post with at least 6 months of their medications so that they have that buffer, and follow up with the health unit as soon as you get there. so that we can help anticipate your needs and plan for those prescription refills in the future. So yeah, a plug for Medcare Management. That's the program we have in clearances now. Reach out when you get your next clearance, regardless of your classification, and talk to your care manager, talk to your nurse or provider that's doing your clearance and say, hey, I want to know how to get this medicine at Post. And they can contact Post. We can look and see what's available, and we can sort of guide you through the process of what might work best.
I'll add something to that because obviously the RMOPs, we're ordering lots of medications for people overseas. My experience has been, and it's weird because some people, their mail order goes through like no problem. And then other people, it just is always a struggle. And I don't have an exact answer for that, but I know a lot of times patients end up having to just get on the phone with their mail order company and look through. Sometimes there's a birth date wrong somewhere or some sort of connecting thing when they change insurance. There's sometimes something in the back that it takes like the right person to figure out, but who knows? The other thing I wanted to add on that though is, you know, we write for a lot of medications for that are controlled substances for like kids, for example, with stimulants. And really the only way to consistently get that overseas is through like Express Scripts or CVS Caremark. So it's really important that families think about like what insurance they choose. We don't tell people what to pick, but you want to make sure that your insurance actually has real mail order benefits because some of them don't.
No,
Yeah,
very, very
That's
valid
hugely
points.
important.
I mean,
And
not to plug one over the other, but like we have, other than Express Scripts, we have been amazingly happy with our insurance, and it works stateside, it works overseas, and it definitely, you have to make those informed decisions when you join the Foreign Service.
Yeah. And I will add that a PCS is a qualifying life event for choosing insurance. So each time you PCS, you have the option. I think it's 30 days before and 60 days after, or reversed. But basically around that PCS period, you have the option to change your insurance.
And for some people that are really frustrated with their mail order, you know, you want to go to Post with it set up, but there are other options. I mean, I have some people that choose to just get the medication locally because it's cheaper and easier. So, you know, you can talk with your health unit provider, and, you know, some people just, depending on the Post and the climate of what's going on with their mail order company, they can kind of, you've got some options sometimes.
But a really important conversation to have as you're bidding and moving to an on-order assignment. Just one more general kind of question before we dive into mental health. And you referenced this a little bit, Jennifer, but talking about how does Post or Med determine if local testing practices and equipment are at standard? Like, I mean, beyond like not wanting to divulge any sort of like confidential information about other patients' experience. I know here in Sri Lanka, we've had some situations where the equipment's great, they just don't know how to use it. And so like how do we know, beyond bothering Med or our health unit with these questions, is there a better way to do this? Is there like, do we take Thailand for its medical tourism, you know, out for a spin? Like, how do we get these tests and procedures done?
Yeah. So are these health unit approved facilities that you went to?
Here in,
That
well,
the readings were bad, or?
it was it wasn't my own test, and it was the equipment was up to standard, and then there's like one guy that knows how to use it, and then like he wasn't there that day, and so anyway, it ended up that it wasn't a good test nor a good result, and so it was a waste of time basically.
Right, and that'll happen. And you know, one of the limitations, the big limitation, is we have no way of independently verifying the credentials of providers overseas, right? Like, we don't have the same credentialing bodies. This is another reason why someone might tell you to go back home for your care in particular situations, because the sort of safeguards and institutional standardized medical expectations and you know, the way we have accountability for those things in the United States doesn't exist in a lot of other countries. They just don't have those systems implemented. And so what we do is we keep lists in the health unit of the places that we recommend that we think are up to the closest standard. If you have something like a test, a lot of times we'll go, you know, we have different types of specialists within our ranks as US providers, as Foreign Service medical specialists. So Dr. Queenan is a psychiatrist. I'm a medical provider. We also have regional laboratory scientists. So we have laboratory scientists that go, that are stationed regionally, and they go to posts and they sort of verify the accuracy of testing facilities. Radiology is a little different. They don't cover radiology, but they at least cover the types of blood tests, you know, genetic tests, hematology, serology, things like that that you might have done. We also have a resource called Northwell. And what that is a provider back here in the United States that if we're questioning a read, or if we're questioning something, if the provider in the health unit is questioning it, we can have someone back here take a look at it, like a US-based specialist, and kind of give us an idea. But I guess for people at, you know, at post overseas, my recommendation would be to go to the health unit first and see who they recommend. And it's tough because sometimes they'll recommend someone and then that person will send you to something else that was not known to the health unit. So I think keeping the health unit in the loop as you're getting specialty care on the outside market is really helpful. They can help you navigate that and make sure that the care you're getting is good quality care and that, you know, the tests are reliable.
No, that really makes sense. And thank you for that explanation. Let's talk a little bit about mental health and how it relates to clearances and moving, especially. So if someone were seeing a therapist for some sort of disease like depression, anxiety, maybe ADHD, and it's during their tour, what would be the process for receiving the medical clearance for their onward assignment?
That part's pretty much the same as everything else. You would just include that on your medical clearance update form, and it would go through the regular clearance process. So I get asked the question a lot, you know, about medical clearances and mental health stuff. And the thing I always kind of lead with patients and families is it's like, you know, just a little reminder that, you know, I'm overseas, you're overseas, we're in the health unit. I'm actually treating people for routine mental health care. So really that's meant to actually promote people being overseas with routine needs for mental health. So it's just kind of a reminder of perspective, right? You know, if people are asking, well, is this going to keep me from going overseas? Well, it's like, well, but you're already overseas and you're getting care and I'm helping you out, you know? So it sometimes just helps to keep that in perspective that it's not, you know, it's something that happens regularly. People go overseas with these types of routine needs, but the process initially is pretty much the same.
But there is a difference between when you're at a post where the RMOP is so readily accessible versus you are at a post where that RMOP will rotate through, you know, every few weeks or so. I mean, is that a different consideration?
In terms of for the clearance part?
Yeah. Like if I were, so for example, you can't have an RMOP at every health unit, and that totally makes sense. But if you were at a post, I'm trying to come up with an example. So like when we were in Africa, the RMOP sat in Dakar, and you know, our particular RMOP at that point, like serviced like I want to say like 9 countries.
Oh, sure. Yeah, so most of the patient care that we do is telemedicine through WebEx or Teams. So yeah, I may get to a post when I'm overseas just a couple times a year. So most of what I'm doing is telemedicine. As far as with the clearance, you know, if anything, I think the fact that we do telemedicine and that a lot of stuff, particularly psychotherapy now with adults, is available by telemedicine has kind of allowed us to kind of go along with a lot of the changes that are happening and sort of open things up in terms of the clearance process. So, you know, I think what people are going to find is there's going to be less of a deep dive for routine stuff. So being on a routine medication being in routine therapy, for adults is probably not likely to flag a deep dive into the medical clearance process. We've lowered the review from 7 years to 2 years as far as what we would go back and review if there is a review. For kids, it's going to be probably still more comprehensive. We're hoping to keep it collaborative, but it's just there's more complex issues with education issues and medical issues, sometimes development issues. So those are more complicated. But for adults getting routine mental health care, I think people are going to find that it's going to be a lot more straightforward
So
with the clearance
it-
process.
for getting the routine regular care, I know that the RMOP provides it. Is there anything that Med can do to help with? Apparently, there's really long wait times for groups that like Truman Group and other counseling options.
Yeah, so we're one of the options people have when they're overseas for mental health care. There are sometimes local resources. I've been surprised some places I've gone that there's, you don't want to make an assumption about what is and isn't there. It's good to ask the health unit. Sometimes there truly isn't local resources, but sometimes there are. And we do some of that vetting process. Obviously, we're going to be particularly interested in not only the care that they're providing, but language skills, their ability to sort of like engage culturally with patients if they're doing therapy, things like that. So we often have relationships with local providers that can do mental health care. And then we do have people working with a lot of private groups. Truman Group is one of them. I know wait times can fluctuate. Basically, the way we try to work around that is to try to get additional resources because it's a supply and demand thing. Just like in the US, wait times can be 1, 2, 3+ months to get in. So I think with Truman Group over the last 5 years, I've seen it kind of go up and down. If someone was noticing a really long wait time, like 4, 6+ weeks, it's probably good to talk to the RMOP about that, just to think about what other resources are. But I know it fluctuates quite a bit just based on how many providers they have in that region available and the need. So, but it's good to talk with your RMOP if you're finding that you're having trouble. We do keep a small private list that we're always kind of updating. We try to keep it something that we work together with patients on so that we can make sure that it's truly up to date. So we don't like distribute it broadly just because then we kind of lose control of the integrity of it. So we're always looking to try to increase telemedicine options for mental health. And they are out there. There's issues, there's limits. We don't have control over what a U.S. provider is willing to do as far as seeing somebody overseas, because I know sometimes we'll get that question, well, can you tell my therapist it's okay to see me overseas? That's really up to the provider, but we try to keep, tabs of who's willing to do it. And some of the larger groups like Truman Group, of course, people use pretty regularly. But
Well, so to bridge into kids with special needs, is there anything that you would recommend if a family were to have a family member who has some sort of mental health condition that they are seeking therapy for, or a child with special needs? Is there anything that you would recommend that they do, maybe above and beyond that regular clearance, in order to help facilitate moving, in order to help facilitate their landing well at their onward assignment?
sure. So I think
I
the
know
first
that's a
thing,
big question, sorry.
yeah, there's a lot of parts. The two big parts of it, I think, are just to begin the process earlier than typical. So what I would say is for new hires, go ahead and think about starting your child's clearance at the same time you're doing your clearance. For people moving overseas, if your CDO says get the clearance started, in March, maybe start in January with the kids, just to give it plenty of time. There are changes happening with the kids too. We have educational consultations, which it's really more of a consultation thing where we're gonna, the staff with Child and Family Programs is gonna work with families to understand what's available, help them work with overseas schools, but there won't be a requirement for them to get the approval letters and things like that. Although that's still considered kind of the gold standard of what you want before you go to a post. But they're going to work with them on that if they choose to work with CFP to try to help them, just understand what their options are. But to get prepared, applying early for your clearance, and then really trying to keep a good paper trail. The medical stuff will often be in the chart. We now have the electronic health records. But I think it helps if families keep their own system in a cloud or something where they've got learning plans and school reports and any documentation of previous psychoeducational testing and stuff like that. Any of that stuff that you have readily available and just keep. It's good to have it for the clearance process. It's good for the schools because the more efficient that everybody is on our side and on the family side, getting us the paperwork that we need to do the clearance, the faster it's going to go through. And it's paperwork. I know it can be frustrating, but just realizing it's a process. And the goal is really to make sure that you don't end up at post not having what you need for your kids, right? So.
Mm-hmm.
And
I'll
the other
add-
thing, especially with the schools, is really to be careful not to make assumptions, because I think I've seen parents, just, have no way to know otherwise, but, just assume a service is pretty routine, whereas international schools, we don't own them. They're private entities. They may or may not have things that you as a parent might think are pretty routine. So it's good not to make assumptions about what's going to be at a school as far as a particular type of learning service.
And I'll just add to that in terms of being proactive about your medical clearance and getting things in. We do almost 30,000 medical clearances a year, and we probably do 2/3 of them during a 4-month period in the summer. So there is a seasonal flow to clearances. It's during transfer season, and it gets absolutely slammed during the summertime. We are firing on all cylinders and just working around the clock to get people to post. Pro tip for all your listeners, because they're listening to this podcast and they're A+ students. The tip I have for them is the quiet period is November through February. So if you want to get your clearance in and get it turned around and quickly, aim to try and do it during that period. Now, if you have a child with special needs, you might even need to start earlier to get some of that paperwork together. But if you're just trying to get your clearance through, that's sort of the sweet spot of when it might be the quickest. So pro tip for your listeners.
And to tag onto that, July through September is very busy for special needs education allowance applications. Summer, beginning of school. And it's the same team that does the mental health clearances for kids. So that's also going to be a super busy time. So if it's possible to get it in before that, then that would probably be beneficial. So I'll add that.
Excellent suggestions, because it's already stressful enough moving, let alone trying to deal with all the paperwork and everything that's necessary for those kinds of transitions. I am often, and this is a total aside, as we look at special needs, I am often very confused at parents that are just assume that, they're foreign service, so of course the international school will accept them even if their child is special needs. And I can't believe that they don't understand that the feedback from the school, who would know what their limitations are, and are saying they can't meet the needs of their child, but they still feel they should bid on that post. So I do hope that everyone is who is listening and may or may not have this consideration would listen to what the experts are telling them. Sorry, that was a total tangent, but my little soapbox. But on special needs, when kids are maybe upper middle, lower secondary, when these types of special needs diagnoses might most likely arise, what will the considerations be for testing and learning plan development, especially when it comes to maybe moving in the near future?
And I assume you mean psychoeducational testing. Is that what you're?
Yeah.
Okay. Sure. So if the family is at post and a new educational need is identified, first start with the school. The school is primarily going to be the one involved with writing the learning plan, sort of establishing what the needs are. As far as psychoeducational testing, that can be done in a couple of different ways. Some schools know of a local resource that can do it. You can also talk to the RMOP for the region and the health unit that they have. They kind of keep tabs of who those people are. Nowadays, some psychoeducational testing can be done online. Depends on what it is, how old the child is. So we have some options. Special needs education allowance can help reimburse for psychoeducational testing as long as it meets the correct criteria. So that's why it's important to have everybody involved, because the family is going to probably need a letter from the school recommending it. It can only, be done, in a certain period. Like, you can't have it within too many years close to each other unless there's a reason. So having all of these people involved is going to help with getting it approved. But special needs education allowance, when it's approved, can help reimburse for the testing. Typically, if you're going to do it while you're overseas, the Child and Family Program is going to try to help you find a place to do it either online or overseas closest to where you're at. If you do want to do it, though, just by your own personal preference in the United States, definitely plan ahead, probably 3 to 6 months, but you can do it when you're home on some type of leave. And if it's approved, it can be reimbursed for the testing. Now, they're not going to pay for you to fly back to do that for routine testing for a middle schooler, but a lot of families will choose to do that because they'd rather do it in the States, and they just tie it into some sort of travel that they're already planned or funded themselves. Is that kind of cover the bases on that? Yeah, because there's lots of layers.
It's like an onion, right? Yeah.
Yeah.
I mean, it's not an easy conversation to have anyway, but then to try and slide that into the R&R travel when it's already such a stressful period. And I know it's not just one test, it's a series of tests and evaluations. And
I would say a lot, it depends on where you're at, right? But, in South America, I had a lot of families that would get the testing done in South America somewhere. So, it just because it's easier. So, and if it's regional, now, of course, this is all dependent on the application and it gets approved. But if everything gets approved, if you're doing it somewhere close by where you're at, so let's say you're traveling from, Guyana to Peru or something like that, that could potentially be funded travel. It just has to be to the closest center that's near you. And Child and Family Program would work with the family to try to figure that out. It just, some families get sort of maybe not the best information from some people that you can automatically get it paid to go back to the United States to get testing. And that actually isn't correct. I think that's some lingering thoughts that some people have. I don't know what it was like a long time ago, but that's kind of what that would look like. So I think a lot of families choose to do it overseas, but there are options. That's where just having that connection with Child and Family Programs, go ahead and start with the school, find out what they're recommending, and then just go ahead and apply for the special needs education allowance. And you can do that by talking to your RMOP or just directly contacting CFP.
thank you for that. So I actually only have one question left, and it is sort of a bridging between general care, not necessarily clearances, sort of mental health. But one of the questions that has come up a number of times in our different menopause focused podcasts is feeling as though the care and or treatment given by the health unit is not like necessarily taking their symptoms seriously. And not just, I mean, the question is specific to menopause, but it isn't necessarily only menopause where this might come up. So what advice might you have to someone who feels as though what they are bringing to the health unit isn't being taken seriously? Like what can they do to advocate for themselves? Jen, I think you're muted.
Jen, I can't tell if you're.
I think
Okay, I didn't want to jump in.
in general, just best practices are, when you're with a health unit, it's important to be upfront with what your expectations are, especially if you're feeling like you're not being heard or frustrated, and let them know, hey, I wonder if the symptoms I'm experiencing could be X. Let them know if there's something, there's a lot of information on the internet. Some of it's good, some of it's great, terrible. Let them know where you're coming from, right? I think that's always helpful when I understand a patient, what their perspective is, and sometimes I'm trying to reassure them like, hey, you don't have this horrifying parasite. I don't think you do. And they're saying, and I'm thinking that's going to sort of make them feel better. And they're going, no, that's not enough. Like I need more than that. Right. So let me know what your expectation is. I want to know if there's a test you can do to rule this out. I want to know if there's any medications I should be taking to take care of it. I want to know what the types of treatments or what your experience has been in treating this disease before, right? Like those kinds of things help me understand how to best care for the person in front of me, right? And so if you feel like you're not being heard, there's always this chain of command that we have, right? Like you can ask for a second opinion from another US trained medical specialist within this, region. So, if it's a local provider, you would speak to the medical provider at post, the next US direct hire. There's always a regional medical officer. That's a physician who's overseeing several posts. You can ask to speak to the RMO. And then there's a regional medical manager who's sort of overseeing a continent. So you could say, hey, I'd like to just speak to another provider, please. Could you refer me to, the RMO or the RMM or the medical provider at post? I think that's usually a good way to approach it. And be specific, hey, what are bioidentical hormones and how are they different from, birth control? And why are you suggesting that I be on progesterone as well as estrogen? Or like be really specific with your questions, I think is always helpful. Like I said, there's a lot of information out there. And there's reasons why a particular type of treatment might not be appropriate for one patient over another. And if we're not doing a good enough job of explaining that, ask us, I think is important too. And then there's local providers. Ask, is there someone on the local economy? Like in this example of menopause, you could say, hey, do you have any OBGYNs locally that I could chat with? Is there anyone locally that you would recommend?
That's great advice and really helpful for helping someone advocate for themselves.
Mm-hmm. And come in with,
I'll add.
I was going to say, come in with a list if you need to, if it helps you organize your thoughts. Because I know when I go to the doctor's office and I'm a provider, I'm a clinician, and I've got those things I want to talk about. And sometimes I just I don't know what happens. And then they leave and I'm like, oh my gosh, I didn't talk about all the things I wanted to talk about. So sometimes it helps to write these things down. Do know that, sometimes the health unit can get really busy and we might not be able to address all the things on your list, but at least it will help you kind of organize your thoughts and feel like you've come prepared and that you're advocating for yourself. Go ahead, Dr. Queenan.
And I was going to add, we in State Department as a culture tend to be very email heavy in communicating. And so I'll sometimes see that be the way that follow-up communication is happening. And so if there's kind of a disconnect and you're not feeling heard, I would really encourage, you to just set up an appointment either by telemedicine or to go into the health unit to talk to whoever you decide you want to talk to. Because sometimes just sitting face-to-face or telemed face-to-face, something like that is going to get, it's going to be better, right? And
that's
you can
a great
have that conversation. Because I think it's easy to revert to email for us sometimes. It's convenient, but when you're feeling like you're in a sticky place, that's probably not the way to go.
I think that's such a good point that you make, Dr. Queenan, because I can think, we're in these communities, we're sort of in a bubble, and you might see one of us in the cafeteria and mention something and think, I'm going to either forget that or not think that it was relevant to your care such that I need to go back and document it and follow it up and that sort of thing. You're also my friend and my colleague, right? So when you said to me oh man, my diarrhea is still not getting any better. And I'm like, oh, that's the worst. Your expectation was that I was going to take action on that. It wouldn't be my expectation, right? So Dr. Queenan brings up a great point. If you're trying to talk about your healthcare and you want to talk business, the health unit's the place to do it. Over the buffet at the, CLO event is not the place to discuss these things. Yeah, because you're not going to get good care out of that. So please, bring it to the health unit and see us in person. That's a great point.
It is amazing, isn't it? How we forget that, we are all friends because it is a bubble. We all know that. But then to bring a professional problem to someone in a non-professional setting. Like, why is that even a nice thing to do? So I appreciate that point very much. Having served in different roles in the management section, I have had that,
Yeah.
not quite, hey, look at this mole, not like that at all, but like, there's never a downtime. I so appreciate this conversation, and I really appreciate all of the points and suggestions that you guys have given. Have we missed anything? I mean, I am very happy to have another conversation, but I feel like this is such a great opportunity to bring up anything that maybe we haven't covered.
I mean, I just want to say thanks, and I'm actually a friend of the Blob, a fan of the Blob. I don't know if you have a name for your fans, like a lot of
You like our blobbers?
yeah, the Blobbers. You had a great episode on Medivacs from the perspective of like the patient and as a parent. I thought that was really great. My one critique of it was that, and I just think it's the language that was used, is there was it was divided into two categories: planned medevacs and unplanned medevacs. And I think what they were getting at is really like emergency medevacs versus urgent but not emergent. Because I will say there's no such thing as a planned medevac. So anything you know, and this kind of goes back to what we were saying earlier, anything you know about while you're home, take care of before you go to post. Because medevacs are really for urgent things that can't be taken care of at post. You just don't have the resources there. So that's the one caveat I would add, but I love your content.
No,
Family.
well, we should put a note on that one. That was more like OB sort of thing. Is that?
Yeah, I guess that's sort of a planned medevac. That is one example. An OB medevac is sort of scheduled ahead of time. We know it's coming, right?
That there's 9 months to plan for that thing to
Exactly.
finally come out of there. And Dr. Queenan, any final points?
I guess just, and Jen's sort of mentioned this early on, but just to kind of leave with the idea that as we're making all these changes with clearances, it's still a bureaucratic process. It's still paperwork and things like that, but we really are wanting to take advantage of all these changes to make it streamlined, to make it easier, and really to have it really be a collaborative process. So there's much more education that we're trying to put into it. And I know it will take time for sort of people's, ideas and way of looking at it to change, but I'm hoping that we're really moving in that trajectory of evolving it into something that really is a more collaborative thing. So I really hold on to that vision that Jen has for it, and I agree with it. So I just wanted to leave with that. So
yeah, thanks, Dr. Quinn. I think education up front is so powerful, so that people understand what it's like out there, right? Like what post is going to be like, what healthcare looks like overseas, how it varies from what your experiences may have been in the past in the United States. So at your next clearance update, there'll be opportunities for us to give you more counseling and education and expectation setting and work with you on managing that. So please, raise your hand if you're interested. If there's more information you'd like to have. We have informational sessions every so often on just the med program and what kind of benefits you have as a member of the program that we roll out through the clearances office. So do get in touch. And I know we've shared some links with you for our sites, and as well as feedback survey. We have a feedback link called Ask Med at state.gov, because we know that we're sort of, like Dr. Queen mentioned, this bureaucracy. We have many offices within us, and we all sort of have our own specialty. So if you're not sure which office to reach out to for a particular ask, you can go to askmed@state.gov, and they'll sort of funnel you to the right resource. You can also give us feedback. It's really helpful if you give us feedback and let us know who you are, so we can get in touch and help you out and clarify and help you navigate. But that's always there, and we're always seeking feedback from everyone out there in the field.
We will include those links in the show notes so you can find those easily. And I do feel like, personally, our experience with health units has always been super caring and really compassionate people working in there. But also, like, it's always, you have to be an advocate for yourself, right? There's no one in that health unit that can read minds. Unless that's a new job qualification that I don't know about. But I always feel like if you go in there and are able to articulate what it is that you are expecting, it is so helpful for them to be able to help, because they want that's why people get into the medical professional. I don't think most people get into the medical profession because, you know, they like wearing white all the time. It's purely because they want to help people. And I feel like this conversation really underscores different ways that people can help themselves and help the health unit help them, and help med help them as well. So I really appreciate all of the information. We will include the links to the sites that you just mentioned. And hopefully this is the second of more conversations with Med, where we help educate folks on the different services that are available to help keep them healthy overseas. So thank you again so much, Dr. Keenan and Director Amona, for joining us for this conversation. And thank you all you folks listening to the Big Purple Blob.
Thank you. Thanks for the opportunity.
Thanks.